Fat, she says, but maybe you're thinking about liposuction. Is it something you've considered? You want to take a little something out of your thighs or your backside? We're going to tell you about something called Smartlipo, and whether or not it's right for you.
And our financial expert.
Coming up, we'll show you what Smartlipo is and why it just might be right for you. And we'll also show you some products.
Have you been considering having a little, as Fred would say, work done, but you just don't really have the downtime? Well, today we're going to talk about something called Smartlipo and whether or not it might be right for you. Dr. Jason Leedy is a plastic surgeon. It's good to have you here.
Thanks for having me.
Okay, Smartlipo, I'm interested. What is it and how is it different than a traditional liposuction?
Well, Smartlipo is a FDA-approved procedure for removal of fat. It involves a laser, and it's different than the traditional liposuction techniques because it doesn't involve a trip to the operating room. You can make a nice improvement with in the office using local anesthesia, and also with a quicker recovery time. Now, it's not a replacement for the traditional techniques. There's still certainly a role for traditional liposuction, and then for the excisional techniques, abdominoplasties, arm lifts, and such like that. But for people with small, isolated fatty areas, that are refractory to diet and exercise, Smartlipo is a nice alternative. And like I said, nice improvement in an office-based setting that's permanent.
And you say just a little extra fat. So like if someone came to you, who would be the right kind of candidate for this, where you would say, you know what, I don't think you need traditional liposuction.
Yeah, someone who is essentially at their goal body weight, that is in good health, of course, that has good skin tone, relatively good skin tone, and has an area that is relatively small. Small meaning 100, 200 cc's worth of volume. That means usually an isolated body area. This is not a weight loss procedure. It is not intended for treatment of a broad area, say all the way around the hip or all the way around the tummy. But if there's a small pocket, say under the chin, in the flank or love handle, on the side of the thigh, if there's just a small pocket, then this is a great technique for that.
Well, the good thing is you brought some before and after pictures, so this might give people an idea of, to gauge whether or not their body type is this way and if they might be right for Smartlipo. So let's take a look first. Okay.
Now she had some loose skin of her neck and referred to it as her turkey neck, and the laser, when it treats the skin, it causes some skin tightening. So that's her before and after, and her skin in an office-based procedure is tightened up and provided for a nicer contour to her neck.
And I would imagine that's pretty common, that there are women, they're concerned about their necks.
Oh, absolutely.
And skin hanging from the neck.
Absolutely. It's one of the things that really leads to an unsightly appearance in a lot of people's minds, and it's nice to tighten the neck. That refreshes the overall face. Now, this patient had a little bit more fat in the neck, and again, using the laser, office-based setting, with a weekend of recovery, she wore a sling around her neck for a weekend, has a nice permanent result.
Very nice.
It works for men too. Men have similar problems. And this guy had a little extra underneath the chin. Didn't like how it made him look a little older than what he felt. And again, office-based procedure. The fat underneath the chin has been tightened. But it's also good for the body.
I know. This is the side that we women are concerned about, right?
Well, you know, this patient is thin, healthy, works out. She just wasn't happy with the shape that she had on her lower body. So, again, treatment in the office with local anesthesia. The flanks were treated and the lateral thighs. And the end result being, here you see her on a three-quarter view, that lateral thigh has nicely improved. That fullness that she had is now gone.
And as you mentioned, it's not for weight loss. It's just kind of smooth out a certain area. On a couple of these, here we're looking at the back.
Yeah, and again, for men as well, love handle area is a problem spot. Extra fat collects around the midsection. And again, in the office, he had this area treated and nice improvement.
Okay. You mentioned on one of them weekend recovery. That's what it is? Just a couple of days?
Yeah, a few days. For the neck, it's important to wear a sling for 2 days, for the week to 2 weeks. But recovery is measured in days. People are back to work after 2 days.
And you said it's kind of a laser treatment. So from where I was sitting, it didn't look like there's any scarring.
No, the laser is treated under the skin.
Under the skin.
Yes.
Okay.
Yeah. So there's a small incision.
Oh, okay. Well, it must be really tiny because I couldn't see it from sitting here. All right. We want to let people know how to get a hold of you. Good. You're with Cleveland Plastic Surgery Institute, Dr. Jason Leedy, 440-461-6100, or you can log onto his website, drleedy.com. Thank you very much for being here.
Having me.
Good to see you again.
You too.
All right, stay with us. We'll be right back with much more of Good Company. We're going to give you some important medical information for kids who suffer from asthma. And then we're going to show you